price transparency and affordable healthcare options are critical for patients. But what I've learned from constituents across the state is that a well-functioning healthcare system entails much more. Accountable and fair licensing boards. Many licensed professionals in the healthcare fields have had their careers stifled and their lives practically ruined by a dysfunctional or out-of-control board. It has been eye-opening to hear their stories, and it's been an honor to collaborate on legislation to help right some of the wrongs that so profoundly affected their practices and their patients.
He came to me because his parents wanted him to feel better. They had been to numerous medical providers in his 11 years of existence. He'd had things like asthma, weight gain, insomnia, bedwetting. There were a lot of supposedly disconnected things that were piecemeal being treated. I saw it as an inflammatory condition, and I just knew that an off-label use of a drug called Benicar could make the difference in his life. Over a 9-month period of time, he stopped wetting the bed, he slept through the night, he stopped having chronic headaches after school every day. He lost weight, and he joined his basketball team for the first time in his life. He could run the court without using his inhaler. Unfortunately, in March of 2012, there was a lot of gastroenteritis, which is a viral condition affecting the stomach. And he experienced nausea, vomiting, and diarrhea, and ended up in the emergency room, along with his father, who also had the same condition. Unfortunately, I was blamed for that. I was blamed because he was on an off-label dose of Benicar that they didn't understand. They didn't pay attention to the fact that it was gastroenteritis. I got blamed instead for using Benicar, and they called it Benicar toxicity. Benicar toxicity doesn't exist. It doesn't have a toxic dose. It would have taken over 2,175 pills for someone to become 50% toxic at 100 pounds of weight. That wasn't going to happen. This was the most horrible experience that I've ever experienced in my professional life. My licenses were stripped, my patients gone, my private practice closed, and I ended up in jail. This child wasn't toxic. He was dehydrated, and I was blamed. This ultimately resulted in over $500,000 of costs to my husband and I. We had to take the money out of our retirement plan. In 2015, when my case was finally dismissed by the criminal courts, and I had a probationary consent with the Arizona State Board in place, I decided that something had to be done. Senator Nancy Barto became a champion for me.
SB 1445 protects patients and families by ensuring that no Arizona-based regulatory body could choose to punish a healthcare professional for simply the act of educating about or offering lawful healthcare services. Senate Bill 1445 further protects patients from a fear that a healthcare professional might not even discuss a lawful healthcare service for fear of his or her job. This is a concern more than ever. Provider organizations, whether they be physician groups, hospital corporations, and venture-run groups, are employing a growing percentage of doctors and other healthcare professionals. At the same time, new payment methodologies are putting more money for these groups at risk for the cost of care they provide.
She helped, along with others, write that necessary legislation that made sure that we protected speech and practice here in Arizona for both patients and providers.
There's more work in progress. Learn more at nancybarto.com. Thank you for your support.